Today, we'll begin a simple primary care review on HIV in pregnancy. There are thousands of HIV positive women who are pregnant that give birth every year. With proper management, pregnant women can achieve viral suppression and have a normal conception, pregnancy, and vaginal delivery. Acute and early HIV infections, where it is referred up to 6 months following HIV acquisition. Symptoms of an acute HIV infection can be asymptomatic or characterized by fever, headache, lymphadenopathy, sore throats, rash, myalgia or arthralgia, or diarrhea. Chronic HIV infection is referred to the infection period from 6 months to a progressive decline in CD4 cell counts of 200 cells per microliter. Most people with HIV have few to no symptoms prior to developing severe immunosuppression. Some patients experience fatigue, sweats, weight loss, oropharyngeal or vulvovaginal candidiasis, and bacterial folliculitis. The manifestations of herpes simplex virus, varicella zoster virus, and human papillomavirus infections are way worse with HIV. AIDS and advanced HIV infections are defined as having a CD4 cell count of less than 200 cells per microliter, or the presence of any AIDS defining condition, regardless of the CD4 cell count. The term advanced HIV infections is referring to infections where the CD4 cell count is less than 50 cells per microliter. AIDS defining conditions are opportunistic illnesses and certain malignancies because of immunosuppression. General transmissions are usually transmitted through sexual intercourse, exposure to infected blood, or perinatal transmission. Risk factors for the transmission include high viral loads, certain sexual behaviors, and the presence of ulcerative sexually transmitted infections. Mother to child transmission. Maternal plasma transmission can occur during pregnancy, at labor, and delivery. Breast milk transmission can occur through breastfeeding. The different types of screening would be HIV testing is a routine screening for pregnant women. HIV testing should be performed in patients with clinical signs and symptoms of acute or chronic infection. And lastly, there would be a screening necessary for people with a possible exposure to HIV. The prevention of transmission. Routine HIV testing during the initial antenatal visit to identify women with HIV early during pregnancy. Initiation of effective antiretroviral therapy at the time of diagnosis of HIV infections. Delivery by a skilled birth attendant and at a hospital. Infant antiretroviral prophylaxis. Follow-up services. And lastly, for children determined to be HIV infected, rapid referral to HIV care and treatment services would be necessary for immediate initiation of ART. Thank you.